Here's Hank.
Oh my gosh, Hank.
See how blonde he is, Grandma?
Yeah. Allison and Brian Morrow delivered triplet sons September 30th. The boys weren't due until December 11th, so Allison had an emergency C-section in the Neonatal Intensive Care Unit at St. Elizabeth Regional Medical Center.
We live in a small town out by Grand Island, and they, at the time, well, when I was going through the whole pregnancy, there wasn't a high-risk OB out near Grand Island, so Lincoln was the closest place. And we have a lot of family here as well, so we decided that Lincoln would be the place where we would have the boys and deliver.
I think they're adorable. I could hardly wait to see them. This makes me 20 great-grandchildren, all under the age of 10. So I have 10,
under the age of 10.
and I have 10 boys and 10 girls now. So
Teddy's the oldest triplet and weighed 3 pounds 6 ounces. Hank and Max came next and were both under 3 pounds. Like the triplets, around 500 newborns a year need specialized services in the NICU. And nearly 3 years ago, the hospital added 6 around-the-clock neonatal nurse practitioners to help with the attentive care that the babies require. Nurses Jennifer Gailey and Lori Niemeyer are 2 of the neonatal nurse practitioners. They're nationally certified, advanced-level trained, and educated nurses already experienced in NICU nursing. And both NNPs happen to deliver their own babies in the St. E's NICU.
What more? I love you.
I love you too, Deacon.
Nurse Jennifer Gailey's son Deacon came 5 weeks early, but from already working in the department, she wasn't overly worried.
Actually, it made me want to be a nurse practitioner even more because I knew the nursing aspect of what was going on with him, and I was just in the middle of school, so I really wanted to get to know more of what the nurse practitioners were doing in their day-to-day tasks to care for him. So it really made me want to be there more, and it made me value my coworkers a lot more.
One of Jennifer's coworkers is nurse Lori Niemeyer. Lori's career path changed after her own daughter spent 6 weeks in the NICU. She decided to go back to school and become an NNP.
You know, the experience of just having my baby in the unit has helped because I can see the other side, the parent's perspective.
NNPs build strong relationships with the parents and bond with the babies. They decide what feedings, medications, and therapies the babies need every day, and then they write up a plan and coordinate with the nurses, physical therapists, dietitians, and the physicians.
I think Lincoln is really lucky to have us here at St. Elizabeth's because we have the nurse practitioners that are here in the NICU 24 hours a day. Someone is always here for, a high-risk delivery. If a baby out of Lincoln needs help, we're always there to go, and someone's always on call to replace too. And a lot of hospitals around here don't have that ability to have a nurse practitioner around 24/7.
New mom Beth Engel came from David City to deliver her son Eli 7 weeks early.
It seems like sometimes, 40% of the patients will be from outside of the Lincoln area. And I actually live outside of Lincoln. I live in the Cortland area, and so commuted, 30 to 40 minutes to see my baby twice a day. And so that gives you a whole different perspective too. The closer you can be to their home community, the better, because I think even that extra hour that it takes to drive up the road to Omaha makes a big difference for families when they're doing it every day or for a long period of time.
Allison says that working with the NNPs has made their family's experience even better, and Nurse Jennifer was working the day the triplets were born.
And it was a busy day, so, the neonatologist was having to deal with some other children, so, since I was here, I got to work one-on-one with Mom what was going on with him, so I've got to know her really well, so we have a good working relationship.
You get multiple opinions then from the nurses, the nurse practitioners, and the physicians too that are here. So I think it's good to talk to each one of them and kind of get some of their advice and answer a lot of our questions that way. I mean, we can't say enough about St. Elizabeth.
St. Elizabeth Regional Medical Center has 26 private rooms in the NICU. They all have family-friendly accommodations, and they're equipped with the latest technology. And for families experiencing an unexpected early delivery, the NNPs are here around the clock, day or night, to take care of these high-risk babies and give them the best care that they need. Reporting for Lincoln Specialty Care, I'm Kate Ellingson.